Hello. Hi there. How are you doing today? Good. I'm sorry to hear you're not feeling well, but just take it easy and hopefully we will be in and out of here in a few minutes, okay? Do you know why you're here today? Okay, well, looking at my notes here, it looks like you were recently in an accident and we are doing a concussion test on you today to see if you may have a concussion. Does that sound familiar to you? Okay, great. I know it can be a little stressful for the mind after an accident or something traumatic, so we want to make this as painless and as quick for you to make it relaxing and not triggering. So looking at my notes here, it looks like you were not too unconscious when they found you. You had good consciousness. Your airway was fine. Your breathing and circulation were good. So because of that, we are just going to be checking for your cognitive abilities, so your brain function, to see if there might be any damage from the accident, and possibly just do a quick light and finger eye exam for you today, okay? All right, do you have any questions for me before we get started? Okay, perfect. So before we do the eye exam, like I said, I want to check for cognitive functions. So that's just going to be asking you some basic questions and writing down your responses. It's also a fun way to confirm the information provided to us on your record. So if that's okay, we're going to get started with a pretty straightforward question. So if you would mind providing me your name. And can you spell your last name for me? Okay. And do you know where you are right now? Oh, you got the address and everything. That's good. Sometimes I don't even know our address. And then if you don't mind, would you mind giving me kind of a brief overview of what occurred before you arrived here? Just kind of basics as to the accident and what you believe happened. Mm-hmm. And how long was that sight not around for? Were you struggling with seeing? Just a minute or two? Okay. And then when you came to, what was the last thing you had remembered before possibly losing consciousness for a bit? If you can. It's a little fuzzy. Okay, not a problem. Sometimes with accidents, especially ones that are more traumatic, memory is not always there, and it's not a problem, and it doesn't always mean that there's an issue. I mean, I can't even remember what I had for breakfast yesterday, so with traumatic events like that, it's not uncommon for there to be a little bit of memory loss. Okay. And then just some more basic questions. Do you know what today's date is? Okay, and do you know what city you were born in? Okay. So, cognitively, the good news is it looks like you are pretty aware of what's going on, which is good. That is a big sign of a concussion, is when you don't have kind of mental awareness. Things are really foggy, and not just what transpired before your accident or after, but more so basic information such as your name, your birthday, what the current date is. Sometimes people ask who the president is, just kind of questions that should be known on a daily basis by an average person without a concussion. So that's really good. I, again, wouldn't worry about forgetting a couple things, but just to be sure, we are going to do a finger test as well as a light test. And the reason we're doing this is because some common symptoms of a concussion, besides mental awareness and loss of that, are things such as sensitivity to light, inability to focus, pupil dilation issues. So we just want to make sure that there's no issues with your eyesight or your ability to react to light, which could be a symptom that we need to maybe investigate into a possible concussion, okay? All right. Have you noticed any sensitivity to light since the accident that you can think of? Okay. All right. That's good. No, that's not a problem. That's good that for the most part there hasn't been light sensitivity coming right out of an accident. There could be that anyway, just kind of a lasting kind of side effect with all the stimulus going around and coming to. There is going to be a little sensitivity from that naturally, but in the last, let's say, few hours, have you noticed that light or even sound? As you notice, I'm kind of speaking a little quieter because issues with sound sensitivity are also a symptom of a concussion sometimes. Okay, nothing in the last few hours. Good. Okay. All right. So I'm going to put this down. And before we get started, just to let you know, I'm going to be a little more up close just to show my finger and get it within a perfect or a more normal eye range rather than being far back. Helps with the pupil focus. So I'm just going to quickly sanitize my hands. I won't be touching you, but just to create a more of like a sterile environment, just for our safety. So I'm first just going to do a finger test. We're not going to do anything with lights yet because, again, focusing and pupil dilation can be a symptom on its own with or without light. So we want to do a quick finger follow test just to see how your eyes are working and if there's anything that we should be aware of or anything that's possibly triggering a red flag for a concussion, okay? All right, so I'm just going to hold my finger up and I'm going to ask you to follow it as I travel. So don't move your head. I just want your head to stay focused and just follow with your eyes, okay? All right, so I'm going to have my finger up and we're just going to travel. Alright, good. And now I'm going to do it with the other hand. And if you could follow, please. Okay, good. Alright, and now we're going to do a last type of test where I'm going to use both hands. And I'm going to take one finger. I'm going to bring it to the second and then continue that way. Kind of creates more of a continuous span across the eye range and eyesight area, okay? So I'm going to start over here. I'm going to put my hand here and focus just on this finger, okay? Okay, good. Keep following. Now I'm going to take them up. So you could just go up and down. All right, now just follow the left hand. And now follow the other. make sure to keep the head still. Thank you. Okay. Let's see. So that was good. You moved your head a few times, but that sometimes also is common. Just naturally, you want to kind of move your head when you're following things rather than just your eyes. So that in itself would not necessarily trigger a concussion. Without light sensitivity, your pupils are both looking good. They're dilating, they're following. There's nothing that triggers possibly one eye being at issue or both eyes being at issue. I'm not seeing anything. So it looks good in terms of just a basic test. But now we're going to look a little more at light sensitivity and see how your eyes do with that, okay? All right, let me just make a few notes here. So, like I said, we are going to now be doing a light test. And what that means is I'm just going to do very similar motions, but with a light. So I'm going to have you follow the light. I'm going to turn the light on and off to see how your pupils react and dilate to the change of brightness and things like that. So what I'm going to do first, which is a little different than the finger test, is I'm going to have you cover one eye. And I'm going to have you just do one eye at a time and follow the light, okay? So you can cover whichever eye or side you'd like first, and then we'll just go from there, okay? All right, perfect. So what I'm going to do is I'm going to have you follow the light. Good, keep following. Okay, now stop here. Stop. We're just gonna keep staring right at the light area. Okay. Good. Now let's cover the other eye. Okay. And again, I'm going to turn on the light, and if you could please follow it, that would be great. Okay. So we're going to go to the right. Okay. And again, just going to check the eye there. Okay. This looks good so far. Are you noticing that you're having any issues looking at the light, or it's too bright? Any sensitivity to it that you're noticing now that we're actually kind of forcing you to be exposed to some brightness? Okay. All right, good. No, that's good. Because we would be a little more concerned if you were having trouble looking at the light, following the light, things like that. So far it looks good. Right now, you've done both eyes. I'm going to do a both eye test. So we've done them singular. Let's do them together and just see if maybe there's any differences in eye strength. One eye is following better, dilation at the same time isn't working, things like that, okay? So don't cover any eyes here. We're going to do more of an upwards and downwards pattern. You could follow. Okay. Coming back. Alright, that looks good. Now, stare here. All right, that looks good. Let me just put the light back down and grab my clipboard. All right. So before I take any notes, I just want to let you know that your eyes, in terms of light, look good. Did you notice any sensitivity when both eyes were looking at the light? Or did you notice any kind of imbalances between each eye? One was stronger, one was struggling, one was more fatigued, anything like that? Okay. Let's just say no on pupil, no dilation, pupil issues. One eye, no bigger than the other, pupil dilation. Okay, good, looks good there, nothing. Okay, check that, that looks good. Okay. Alright. Great, okay. Just gonna okay. Perfect. So that's light sensitivity. No, okay. Alright, perfect. So just to kind of recap, I appreciate you being patient and cooperating. I know, again, it can be traumatic and a little stressful after an accident occurs, but we just want to make sure you are healthy and give you an all clear before we send you home, because we would hate if you went home with a concussion and we were not able to treat it or monitor it properly and then something happened to you down the line. So we're just doing our job, and again, we appreciate you cooperating, and you will be home shortly, okay? So, like I said, you have no real issues with eyes in terms of sensitivity to light. You have not been reacting to noise or light the way that a concussion, a person with a concussion would have reacted. You are able to remember basic facts, so your cognitive ability is there, like I said. And as I stated earlier, when I first came in, there was no issues with breathing, your airways, there's no vomiting, which is a common side effect of a concussion or a symptom. There was no drowsiness, anything like that, which would be a big red flag for a concussion. You do not have currently, so that's good. The one thing I would recommend is I think we would like to keep you monitored for a few more hours. The reason we want to do that is because the accident occurred not too long ago, so we just want to keep you here for observation and monitoring should some latent symptoms kind of show up later in the day, okay? So what I'm going to do is I'm going to speak to the primary caretaker here and physician, and what we're going to do is we're going to set you up in just an observation room. You're not going to be hooked up to anything. You're not going to be receiving any more tests. What's going to happen is we're going to put you there for probably the next 4 to 6 hours, as that's kind of coming into the end period of when a concussion would take place based on the timeline of your accident. And we're just going to have a nurse or myself or the doctor come in every 30 minutes or so just to check you out, ask you a couple questions, make sure there are no big symptoms that are showing a possible concussion, and then if all looks good, we're going to send you home and get you on your way, okay? All right, perfect. So if you don't mind waiting here, I'm going to go grab the doctor, let him know what I have found out and our recommendations, and we will get you set up in an observation room, okay? Do you have any questions before I leave? All right, perfect. Well, it was nice meeting you. I'm sorry for everything you've had to go through, but just hang tight and we will get you set up, okay? All right, have a great day. See you later.